Basically, braces or aligners are a medium just to get your teeth straightened. Now, braces as a modality, as a treatment form, it will encompass your metal or ceramic brackets and wires which are fixed onto the teeth. Aligners are more discreet, where they are removable and transparent. Now, depending on the complexity of the case, braces are preferred for more complex cases, and braces are primarily preferred for younger population or maybe teenagers, because for them having the discipline to keep the aligners on, because see, what can be removed will be removed. So that is something that we prefer for younger population or more complex cases. For adults with social, invisible aligners are a better option because they provide a balance between their social life as well as their work life. And they are generally more disciplined with them, so they can use aligners as a treatment modality. So braces treatment is not limited to any age group. If you ask me when should we start looking for problems, so for very severe and obvious problems, they are apparent even with your milk teeth or children as young as maybe around 6, 7 or 8 years of age. So that's when we start with more severe cases, because we get very beautiful results just by starting at an early age, knowing the problem early, and at the same time when we are able to use growth as a treatment modality. Now, growth is something that is slightly unpredictable. It's not something that will happen in the same amount and in the same way for everyone. But having the potential of growth in the treatment gives great results. We've converted a lot of surgical cases to non surgical cases just by identifying and starting early. Now, having said that, adults can also definitely get their treatment done. Braces is not limited to kids. Having a straighter set of teeth will definitely help you in the long run, because straighter teeth are better looking, of course. They are also better to maintain and easier to clean. So, lesser problems as far as your overall bite and teeth are concerned. Braces or aligners, they are not painful at all. Now, with the technology that we have, they are very, very comfortable. Second is, braces will spoil my or weaken my teeth. Now, the whole process of braces is done primarily to enhance your bite, your smile, or your teeth. Teeth which are better positioned will, of course, last you more. You will be able to maintain them better. Another one which I get regularly is, extractions is compulsory. No, extractions are not compulsory. Another one with extraction only is, extraction will ruin the shape of my face. No. Any treatment which requires extraction is planned very, very meticulously. They are done so as to complement your overall facial structure and aesthetics, and not to compromise it. So, aligners, no, basically, they are not to be used while you are eating or consuming any beverage except for water, but they need to be in your mouth for at least 22 hours out of 24 hours. So, after now, this is a very, very important question actually, because hygiene, as far as the treatment is concerned, even for braces or aligners for that matter, is very important. See, the reason why we get braces or aligners done is to improve our aesthetic appearance. Correct. Now, while you have your aligners on, if you're not able to maintain your teeth with the food debris that are stuck, or your gum health, you will have lots of problems later in the form of cavities. So, number one, you are not to have your aligners on while you're eating. That is the only exception that we actually request the patient while we deliver it to them. The only time your aligner is out of your mouth is while you're brushing or you're eating. And like you asked again, after consuming anything, if there is any stain or if there is any smell which is left in the aligner, so primarily you're not supposed to have them on while you're eating. Second, after you've eaten something, you have to make sure that you gargle, rinse out quite efficiently, making sure that there are no debris stuck. Clean your aligners again. There are some over the counter products available also, where you just dip a tablet into a bowl of water, or your aligner box, and it just debrides the whole thing and it makes it nice and fresh again. And then you put it on. So that aligner maintenance is also a very important part of the entire treatment process. An average time for a braces treatment would be anywhere between 12 to 2 years, about 12 to 18 months plus or minus. So maybe we say about 1 to 2 years. There are some very benign or very mild treatments which can be now executed with aligners in less than 6 to 9 months also. And there are a few surgical cases or more complex cases which take more than 3 to 4 years as well. Factors which influences, of course, the complication of the case. And second, in children or in young teens, or maybe pre-teens for that matter, the bones are still growing and more pliable. So the teeth movements happen faster. With adults, of course, because our bones have hardened, the teeth movements are slightly slower, but it's not that they don't work. Here, I would again like to answer this twofold. One, I think we just discussed the importance of maintenance while you are in braces or aligners. Having the debris stuck to your teeth or your aligners can cause very bad long term implications as far as having gum disease and cavities is concerned. So, hygiene maintenance during your treatment is very, very important. And second is the retention phase of treatment. Now, everyone feels just after your braces are off or your aligner sets are done, that's the end of the treatment. But our teeth always have a tendency to shift back to their original position. That's why your doctor will always recommend a specific retention plan. Now, it can be either in the form of a fixed form of retention or it can be removable transparent trays. But we have to be very, very sure of sticking to the retention plan. Most of the cases that we see today are relapsed because the first thing the patient says to me on the chair is, Doc, I didn't wear my retainers. And it's so unfortunate because you go through so much pain as a patient and as a doctor also, so much patience, so much discipline to get the whole thing done, and the entire thing just falls back on its face. So retention is very, very important. That is my one go to point. If you can take anything from this session today, that would be maintaining your retention phase. So these DIY hacks, like I spoke to you about, a lot of them will cause you harm because these things are not regulated. See, basically, anything which is promising to whiten your teeth is a form of an abrasive. So, an abrasive used unsupervised can cause more damage to your teeth than it can do good. So, like I said, something seen on social media and what the reality is, they are two very different worlds. People need to be very, very careful as far as something as simple as getting your teeth cleaned and whitened. You need to make sure that you have a discussion with your doctor about what is the best approach for you. Sometimes the underlying cause or the problem of why you have that in the first place, why you feel you need whitening, is something that can be mind boggling. I had a patient, I'll just share this one example with you, who was a swimmer. Now, we all know that the swimming pool water is chlorinated. Now, can you imagine that chlorinated water was causing enamel loss, and that's why she had a grayish appearance of teeth? There was no way that any baking soda or lemon or turmeric was going to change that for her. So, understanding the cause of what the problem is and then suggesting a treatment is very, very important. Now, imagine if this patient who already has damage because of acid exposure or caustic exposure from the swimming pool, she goes and she tries something like a lemon juice or a baking soda, it will cause her more damage, right? It is not going to help her improve the whiteness of her teeth at all. So that's why I was pointing out that knowing your problem and then tailor making an approach towards a solution is very, very important.